A Smoke-Free Workplace, presented by Shannon Keir. Cancer is one of the greatest health risks to a person who smokes. Some of the cancer risks to a smoker are cancer of the cervix, pancreas, kidneys, and stomach. Peripheral vascular disease or peripheral artery disease affects the arteries of feet, hands, and legs. Smoking, accompanied with other risk factors such as diabetes, doubles the chances of a person developing PAD. Cardiovascular diseases, reproductive effects, respiratory diseases, as well as many other negative health effects are also health concerns for people who smoke. For those who quit smoking, the good news is, if cancer is not already present in the body, the risk factors of developing cancer and other diseases can be reversed. Immediately, it is safe for others to breathe the air around you. Within 20 minutes of quitting smoking, there is an improvement to your blood pressure. Pulse rate decreases, and hands and feet temperatures return to normal. In 12 hours, the body's level of carbon monoxide begins to decrease. In 24 hours, the risk for a heart attack has already begun to be reduced. 36 hours after smoking cessation, the blood is beginning to return to a normal level of carbon monoxide. Oxygen returns to levels that are more healthier for your body. 48 hours after smoking cessation, your body begins to regrow nerve endings. You will notice a difference when exercising as it becomes easier to perform. Both taste and smell become enhanced. Within 2 to 12 weeks of quitting, both lung functioning and circulation improve within the body. 1 to 9 months later, your immune system becomes stronger and you will be able to better fend off colds and flu, as well as notice a reduction in coughing episodes. A better sense of alertness and reduction in shortness of breath will occur. Risk of infection has been significantly reduced. The 1-year clean mark is cause to celebrate, as you have cut your risk for heart disease in half. In 10 to 15 years of living smoke-free, your life expectancy returns to normal and is the same as others who were never smokers. Secondhand smoke, or side stream smoke, is the smoke that comes off the end of a cigarette and poses an increased health risk to those inhaling it due to it not being filtered by the cigarette. Aspong, Hamrick, and Rosado state that for every 1 cigarette that causes damage to the health of a smoker, side stream smoke causes the equivalent of 3 to 5 cigarettes. Ardell explains the advantages of a smoke-free environment in the proposal that Tampa adopts the policy of becoming a smoke-free city. Ardell states that even those who are addicted to nicotine want to quit and may welcome civic support for their best interests and the health and enjoyment of the entire community. By adopting a smoke-free work environment, our company is promoting the best interests of both smoking and non-smoking employees. The air would be clean and safe, not only for employees, but also for customers and their children. Through the employment of the 6 stages of the trans-theoretical model of behavior change, the readiness of a person's determination to quit can be assessed. Through spending time in each of the 6 stages of this behavior model, the individual that is planning to quit smoking will have an increased chance at being successful and enjoying all of the various health improvements that will occur during the first year of becoming smoke-free. By adopting a non-smoking policy, we are showing the public that their health, fitness, and overall well-being is our #1 concern. The trans-theoretical model of change can be used as a guideline to assess a person's readiness to quit smoking and to implement ways to help them through this life change. The 6 stages of the trans-theoretical model are pre-contemplation, contemplation, preparation, action, maintenance, and termination. Positive role modeling is an important component of helping others implement lifestyle changes. Developing a mentor program benefits the mentor and the mentee. For the smoker, a mentor will provide a support system that helps foster improved health and possibly assist them with quitting smoking. Dearborn states that a mentor program is an environment that sets a good example, furnishes the means for the mentee to feel safe in receiving advice, and is a good way to foster trust while building relationships. A mentor program helps the mentor express thoughtfulness to others, which has a positive impact on their health and well-being. According to Wardell, when a person is engaged in helping others, their fight or flight response is reduced due to the activity taking place in the body's parasympathetic nervous system. By mentoring positive health behaviors, both the mentor and the mentee are able to create better health for one another through the increased trust and closer relationship that is developed. Motivating change at each stage of the stages of change model. During the pre-contemplation stage, one way to motivate change is to discuss the impact of bad choices on an individual's health. By making others aware of the negative consequences and long-term diseases that they will be at risk for, an individual will be motivated to move to the next stage of the changing process. The contemplation phase. Contemplators need more consciousness raising. To encourage the contemplation stage, provide materials, research, statistics on the negative impact of bad health choices, and information on the positive benefits to be had with change. Step 3 is preparation. This is a time to assist with assessing behavior and developing a detailed plan. By identifying why a person has developed a bad habit, when they are most likely to succumb to temptation, and strategies to head off negative behavior, the individual will feel more secure in their ability to succeed with the changes they will want to see for their lives. Action, as this is the stage that an individual begins to apply the plan they have created. Encouragement and support are vital to helping them be successful with the changes they are implementing. The same strategies as the action stage can be used to support the maintenance stage. As many people experience relapse in this phase, assisting with ways to avoid temptation, providing countermeasures, and becoming involved in support groups are all ways to help an individual during the maintenance stage. Termination is the final stage. Remember not to be overly confident that the changes you have made are permanent, even if you feel that they are no longer an issue. Be aware of situations and events that will trigger temptation to relapse. 2 smoking cessation aids that can be utilized by an individual that wishes to quit are nicotine-containing gum or transdermal patches. With the assistance of a physician, the nicotine-containing gum has a 40% success rate with helping people to permanently quit smoking. The success rate of transdermal patches is lower than nicotine-containing gum. However, in combination with medication, transdermal patches also have a success rate that is the same as the gum option. There are many reasons to stop smoking. Positive health benefits can be gained immediately and continue for the next 15 years. A smoke-free work environment fosters positive health for patrons as well as the entire work staff. By following the stages of change, smokers have a better chance of quitting the habit. Each stage of change allows for others to be supportive to the individual that is making a healthier life for themselves. Mentors can be beneficial in the change process. For those that are ready to quit smoking, these means, as well as smoking cessation aids, provide a variety of options to make a successful transition into a healthier life.